This is Dr. Kathryn Dao reporting for Room Now. I'm at the ACR 2020 Convergence meeting, and it is currently Monday. There's a great abstract. It's a late-breaking abstract. It's abstract LO4 and was presented by Dr. Kevin Winthrop. And the reason why I like this abstract was they were following patients who were on tofacitinib. These are rheumatoid arthritis patients taking tofacitinib, and this is a post hoc analysis from phase 1 through phase 4 trials and how these patients do with the flu. Okay, so what they did was they followed these patients. There's almost 8,000 patients. And these were patients who were on tofacitinib, 5 or 10 milligrams BID as monotherapy in combination with other DMARDs, or being compared to adalimumab, placebo, or methotrexate. And they followed these patients for 14 to 15 flu seasons. And they found that actually it's no different whether or not you're on tofacitinib versus placebo, adalimumab, or methotrexate. So the rate of the flu is the same. And the majority of cases, about 2/3 of cases, were actually very mild, moderate cases in 34%, and severe cases in 3%. Now, about 1.8% of patients on tofacitinib actually had serious flu symptoms. And the average dose was basically 5 milligrams BID in 6 patients and 10 milligrams BID in 2 patients. There was 2 deaths, one in each 5 milligram and the 10 milligram dose. And both of them died from H1N1 flu. Now, this is the part that I found very interesting, is that tofacitinib was actually continued in 70% of the patients. About 30% of the patients stopped their medicine, and on average, they would stop it for about 11 days. But in the end, there was no difference whether you continue it to stop it. So for me, if a patient has the flu, and this is confirmed flu, not necessarily other respiratory viruses, there's really no need to stop tofacitinib based on this abstract presented from Dr. Kevin Winthrop. So hope that changes your practice. Follow me on Twitter at KDao2011. This is Dr. Kathryn Dao for Room Now.